Here we go. Well, we want to welcome you this evening. We have another very exciting testimonial tonight. It's been many years ago, and Sharon's going to tell you that part of the story, but I will always, and I don't know what it was, but there was something about your story back in the day that just, it's always stuck with me. And Marion was doing some stuff, and I said, well, don't you remember when Sharon Gale was in the hospital? And she goes, I don't remember that. But I do. So I just really appreciate the fact that you're willing to share your story with us. And I know it was quite a few years ago, but what a change in your life, eh?
Oh, yeah, most definitely.
So, Sharon, you are from
Oshawa, Canada.
Canada, yeah, but what province?
Ontario.
Ontario, okay.
Yeah.
Okay. So she's from a long ways away. So I'm just going to go ahead and give it to you and take it away.
If anyone has questions, they can just throw the questions out there, no problem. I started Shaklee when I was 9 years old, so I've been using the products for a long time. So as you get older, you tend to try and be invincible. And of course, I moved out, and the Shaklee products didn't follow me when I moved out. But my parents always, here's a bottle of protein here and there, so it was nice. But what really happened is back in 1995, when I was quite young, of childbearing years, you think as a young woman, you expect your life to be really good. But in 1995, they diagnosed me with systemic lupus. If you're not sure what lupus is where your antibodies attack your good bodies. So my body is always in a fight with itself. And the doctors really didn't understand what lupus was. They literally...
Karen, can I ask you maybe just to back up a little bit or something? You're so funky with your sound.
My speaker's really off today.
No, that sounds better. That sounds better. Thank you. Yeah.
Okay, no problem. The doctors didn't quite understand what lupus was, so I was a pincushion to them. I was also a test pilot project for them as well, because they didn't understand it. So when I was diagnosed, my doctor sent for a DNA testing, because lupus takes a long time to diagnose. So when he did the DNA testing, it came back that I had lupus. He couldn't treat me. My own family doctor couldn't treat me at the time because I was family to him. And he saw what I was going through, so he sent me to specialists. So I went to the specialist, and they literally just love to prescribe and send you on your way. They didn't want to find out what the situation of why this is happening to my body. So they kept prescribing. They started me off with 5 milligrams of prednisone, which they call the miracle drug, and it seemed to have worked. Now, when I was diagnosed, my whole body literally shut down. My joints were inflamed. My dad had to cut all my rings off my fingers. My elbows, you couldn't really see my elbows, my knees, nothing. I was like a balloon. So eventually when they gave me the prednisone, I started balancing out and things started looking good. Then it happened. It was a shock of our life. I couldn't get out of bed. They sent me to the doctor. The doctor asked, oh, we got to release the pressure from your knees. So they had a huge needle to draw the pressure off your knees. I go, what are you going to do with that? He says, oh, I'm going to take water out of your knees. I go, oh, no, you're not. But of course, they tried, and I yelled. So that's when they said, no, we got to admit you in the hospital. What was happening with my body is my nerve endings were sore. And Nobody could touch me. I couldn't wear a blanket, nothing. It was just so sore. So then they bumped my prednisone from 5 mils to 70 mils. And I don't know about you guys. If you know prednisone, once you take that puppy, you just blow up like a balloon. So I blew up like a balloon and I was monitored. I was stable. Then they noticed my heart started pulsating and it was rubbing on my lungs. Then fluid started getting into my chest. So it just started downhill. It got so bad that the doctors literally told my parents she's not going to make it. And my mom was like, "Oh no, she'll make it." So then the next day, both mom and dad came in and they said, "We got to do a conference call." I went, "Okay, yeah, sure, no problem." So we did a conference call and it was to Roland and Dr. Whittam. If you guys didn't know Jim Whittam, he was part of the nutrition team, I called it. So the first question out of Roland's mouth was, "So, do you want to feel better?" And I'm like, "Well, yeah, I might as well. I have nothing to lose, sitting here in the bed doing nothing. I might as well." So he said, "Okay, this is what Jim and I have come up with." And I had to, back then, mom and dad had to smuggle Liquid into the room. I was to take Liquid for every 4 hours. I was to take 4 tablespoons of protein in an 8-ounce glass every 4 hours with alfalfa and B complex every 4 hours. And I think it was performance, but it was something called different back then. And I did that every 4 hours, and they noticed a huge difference. Just the Liquid alone brought my electrolytes up. I was starting to become stable. And so they sent me off. Home I went. 10 days later, I was back in the hospital. So every 10 days, I was on and off, in and out of the hospital, and they couldn't figure out what was going on. But I was still taking the prednisone. Then they put me on Imuran. Then they put me on Plaquenil. So by the time, I would say 3-4 years later, I was now up to at least 8 prescriptions because they all counteracted each other. This is going to help for your stomach. This is going to help for this. And it just went down the line. It got so bad that they were using me as a pincushion, taking blood from me every 2 hours. Now, I don't know about you guys, but if you're sick, your body is not going to produce blood that quickly. So it got so bad that I said to my dad, I said, "Dad, look at me. I look like a drug addict." And Dad said, "That's enough. No more. You're not taking any more blood. Let's give her a break." So that was good. So then they sent me home because of me being such high dose of prednisone. It deteriorated my calcium. That meant my right hip. I was a high impact aerobics instructor at the time. So my right hip had to be operated on. They told me it was going to be a graft, a bone graft, where they take a piece of something from your bone and put it in. By the time they went in to do the operation, I was bone on bone, but I was still bouncing around, doing what I normally do. And they couldn't believe, because I was bone on bone, they asked, "Were you in pain?" "No, not really, but I have a feeling it was the supplements that were trying to generate the liquid in the tissue of the bone." So they did the operation, and I can tell you, I was in physio for 6 weeks. I pushed myself for that 6 weeks of physio. And I know for sure it was definitely the Shaklee products that kept me from literally being alive, because the drugs that they gave me, I still have the bag just to remind myself, if you don't take your supplements, you can go backwards. So I got my hip done, did what I needed to do, but then the lupus kept coming back, kept coming back. It was a very aggressive lupus. And they literally said, your organs are gonna start shutting down, because I had the systemic lupus with the organs shutting down. And it got to the point where I was in the hospital for about a month. And it was hard on my parents, but we kept doing our regime of the Vitally, the protein. And then I remember mom said, come on, we're going to go on a Shaklee trip. I can't remember what Shaklee trip it was. And I ate pineapple every single day. I had cankers in my mouth, and I had to use a mouthwash every day, and you rinse it out. It was the nastiest thing. And when I went there, I ate pineapple every single day. Dad kept saying, what about your cankers? I go, they're gone. So something in the pineapple was helping my healing, I guess, because pineapple's natural. So then when I came back from the trip, I noticed my joints were swelling again. It was starting all over again. And I was like, oh man, this is ridiculous. Then I started noticing the Imuran I was losing hair. I started having alopecia. And it was like, great, losing hair now. So then after the alopecia, it was one thing after another, and it was depressing. I'm surprised. I have to be thankful that my parents were very motivated, because they helped me get through the depression period that I was going through at the time. But we pulled through. Then it was time for my left hip to be done. So I had to get my left hip done. And that was good. It was normal. I was okay. I was getting around. And then finally my blood pressure balanced out, my cholesterol balanced out, my lupus started balancing out. They started taking me off the prednisone slowly, not all at once, because they told me I'd be on prednisone for the rest of my life. Then I was on Zantac, I don't know why. And a lot of drugs. And then finally I went to one doctor, and she goes, what are you doing? I said, well, I'm using my Shaklee products, this and this and this. And she says, well, I'm going to have to release you. And I'm like, release me? She says, yeah, I can't treat you anymore because you're doing your own stuff. I'm like, really? Okay, no problem. Thank you very much. See you later. So then that made me realize I need to take control of my health. After I was dismissed, I went and got a book called Prescriptions for Natural Healings, so I can understand what was going on with my body. What that did is it helped me understand what lupus was. The lupus said it was a arthritic disorder. So I looked up arthritic, and it told me what to eat, what not to eat, and what vitamins to take. Then I went back to the lupus, and it said what to eat, what not to eat, and what vitamins to take. And it told me what else. Plus I was still doing what Roland and Jim was doing. So my body was like, okay. And I was surprised on how my body was just grabbing all the vitamins. I was really surprised. I've never heard anyone overdose on vitamins, but I've heard people overdose on prescriptions. So I thought, you know what? My body will release what I'm not using. Then I went to my family doctor, and he said, Sharon, you're doing really, really good. What are you doing? And I told him, he says, you know what? Continue doing what you're doing. I'm liking what I see. I'm like, okay, I like that. So I got into it more and more, started exercising more. Then I realized things are starting to happen. I'm liking this. My hair was growing back. I'm starting to lose the weight. Then I said, you know what? I think I'm going to start taking down some of the prescription. I took myself off of Imuran. I took myself off of prednisone, which they told me I'd be on for the rest of my life. I took myself off of Plaquenil, and Plaquenil is a type of cancer drug, which I don't see why I needed it. So I took myself off of that. I kept myself on a water tablet and for high blood pressure and whatnot, but then I took myself all off all my stuff. Went to the doctors once and they said, "So what are you doing?" I said, "Oh, I'm just taking my Shackley." "Well, what about your Imuran?" "Not taking it." "What about this?" "Not taking it." And she's like, "What do you mean you're not taking it?" I go, "Which part of that did you not understand? This is what I'm doing." And they're like, "Oh, okay. Well, we'll see you in 6 months' time." Went back 6 months, same thing. Because every 6 months I have to go back. The one thing I had to say, they were worried about lupus eats away at your muscle tissue. They were worried about my muscle. But because of our lovely physique, I was inhaling that like no tomorrow, because physique builds up natural prednisone in your body. And that's how I was able to come off the prednisone quickly. And they didn't understand that. So when they tested me for muscle mass, they're like, "Wow, you really have a lot of muscle." And I'm thinking, "Oh yeah, I do, don't I?" Like this, right? So they were very surprised. I still carry the sickle cell gene, but it's nothing that to be overwhelmed about. I can tell you, I was going to a clinic because I wanted to have kids. And she told me that, yeah, we can make sure you have kids and this and that. My husband Anthony was there, and we went into the clinic, and my husband told the doctor, "What are the chances and what are we really facing?" The doctor literally told Anthony that you're going to have to choose. What they were afraid of is if I had a flare up, they call it, when I'm about to deliver because of the stress. My body cannot handle a lot of stress, and that's why lupus flares up. So he literally said, by the time, one, she can carry, but she's going to be bed rested for the 9 months. Anthony couldn't see me sitting around for 9 months in a bed. Second, I would, if I go into a flare up through my trimester, we would have to decide between myself or the baby. Anthony couldn't do that. So Anthony says, "You know what? I love you dearly. Let's not bother with the kids. Let's just enjoy life." So that's what we've been doing. Um, so when we told her, "No, we don't want to have kids," she says, "Fine." At the time, my blood pressure, when I was, because I was pregnant, my blood pressure was 180 over 90. The poor nurse that was taking my blood pressure had to sit down herself because I think she had a stroke, because she was wondering, "Am I dizzy?" I said, "No, I feel fine." "Do you have a headache?" "No, I don't." And they literally took the cuff off me, zipped me to the room, and said, "You're staying overnight because of the blood pressure." So, of course, I miscarried, but that's part of life. You know, what are you going to do? And they literally said, "Okay, it's because of your lupus." So that stress alone on my body flared up my lupus again. And so I'm like, okay, let's go back to what I started doing. Because, we start feeling better, and what happens? "Oh, I don't need that B complex. Oh, I'm not going to mix the 4 tablespoons of protein." So we use our own body as test subjects with the supplements, which is good. So then I'm like, okay, I got to get back on this. So I got back on it, and I was fine. Then one of the other doctors just recently saw me, and she's literally saying, "Sharon, whatever you are doing, continue doing what you're doing. There is no trace of lupus in your blood work. Yeah, your blood pressure is a little high, but that's normal because of what you're going through. But honestly, you are looking really good." So I'm glad. I'm really glad.
Wow. 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 Isn't it amazing though? the fact that you have gone through that and you can say there's no trace of lupus.
Yeah. Well, this is what the doctor can't believe, because one of my doctors, he's the rheumatologist. Okay. My file is like this big. Okay. And every time I go see him, I sit for half an hour and he flips through, writes notes, flips through, writes notes. He wants to put me back on Imiran. And I asked him, why? Why do you want to put me back on Imiran? Oh, just in case you have another flare up. I said, look, it's been 5 years. Why would I have another flare up? If I do, I know what I need to do. And he's like, okay, but I'm like, no buts. It's my body. So he wrote in his book, Sharon refuses to take the Imiran, blah, 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 blah.
But there's no trace of it in your body, but let's put you on the drug.
Yeah, exactly.
Oh my, well, your story is amazing. And when you started out and you said, I grew up on Shackley and then I left the house, and that's happened to my kids as well, and then they are like, oh, I guess I should use that. And then the one talks to the other one, and because mom doesn't know. You learn that with time that, your parents don't know, and then they come back, it's like, oh, they did know something.
Yeah.
But I find it interesting that they told you that becoming pregnant would flare you up, and it did.
Yeah. I was glad so I didn't have to go through that.
Yeah, and now the fact that when you also said you had alopecia, I was just like, really?
Yeah. Oh, it was big.
Oh, really?
It was depressing. I wore hats, I scarves.
So how long did it take for that to come back?
I don't even remember because I just ignored it. I was focusing more on my joints and everything else. And then eventually mom said, hey, your hair's growing back in. It really didn't.
And again, your protein was such a huge factor there, I'm sure.
Yeah.
And I'm sure you took a lot. What all did you take? Pretty much.
Oh, boy. Let's just say the whole catalog.
Your comment about physique, I don't know who else knew that, but I did not know that built for pregnancy.
Dr. Whittam told me about physique. Back then we didn't have Vivix. I wish we did. We had the Vitally, but Dad got Vitally from Roland, and we smuggled that in. Alfalfa,
Because Canada didn't have it. That's why she's saying that. It wasn't illegal. The way they smuggle stuff across the borders now.
Smuggle it in the room.
Yeah.
B complex, I was taking between 8 to 12. Alfalfa, I was taking 24 to 50 alfalfa just to keep the swelling down. Of course, Herblax because of the prednisone. Lecithin for my brain because we weren't sure if lupus was going to attack my brain. What else did they have? But most of it was the protein and the Liquili and the physique.
Yeah.
I remember at the breakfast conference, I'd be at the table. You know how they have all the Shackley proteins out? I'd be 1, 2, 3, 4 in orange juice, the tall glass of orange juice, and I'd be sitting there, and everybody would be watching me while they're with their 1 teaspoon. I'm like, what's that going to do? If you want to feel better, get your ass into some protein and start shifting it around.
And you know what's so interesting about what you just said there is some people are like, oh, I could never do all that stuff. But it depends on what route you want to go.
Yeah. Well, look at the conversation with Roland. Roland said, do you want to feel better? That's the first question. What am I to say? No? Okay, well, see you later. Of course, I have nothing to lose. I have more to gain. I have a life to live.
Yes.
So if you want to feel better and have no side effects and have results, I bet any money the products will help. You just got to inhale them, not take them, inhale them. You're getting paid to take them.
Right. Awesome, awesome. Does anybody have any questions for Sharon? I will never forget your story. I remember when you were hospitalized one time and your kidney numbers were terrible.
Yes.
And I remember that you were supposed to be taking protein every hour during that time, and the doctor thought something was wrong all of a sudden, or they took the test wrong, or I don't remember what it was. They were blown away by how your kidneys improved.
You got to remember too, what they were looking at is protein in the kidneys. Shaklee's protein is a vegetable-based protein, so it was not hurting my kidneys as much as meat would. So they were only looking at the number factor.
Right,
They wanted
right.
me to get a kidney transplant. My mom says, no, 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 it'll heal itself. Don't
Yes.
worry. And sure enough, it did.
And usually when you're spilling protein, it's because you need a protein that your body can utilize. And
Exactly.
being a vegetable, it's easy to use it. So,
Hey, Sharon, I have a question. How
Go
long did it take your alopecia to correct itself?
That I don't know. Like I said, it just grew back in. I just, my mom noticed it was growing back in. But I honestly think it was the protein, because you have to remember hair is protein. And if I was taking protein every 4 hours, it would distribute on, okay, her nails don't need it anymore. Her eyes don't need it anymore. So by doing that, it helped a lot, because if we don't take enough protein, it's going to take it out of something else.
yeah, absolutely. Any other questions? Nope.
Sharon, with that story, I'd like to give you a big hug.
Yeah.
That's
Yeah.
incredible. The endurance, the stamina to stay with it, the focus.
Yeah.
I mean, it's just, this is a story that everybody should hear. I mean, if you have any doubt about the supplements, if you have any doubt about how much you can take, my goodness, listen to this story. Now, you were taking 4 scoops of protein or something like this every 4 hours.
Yeah.
So you must have been getting about 200 grams of protein at least a day.
Yes.
Yeah.
Yeah.
Wow.
I remember we went to go see Dr. Bruce. Dr.
Miller.
Not, what's
Bruce
his name?
Miller.
Browse?
Browse. Yes.
Oh, okay.
Because he came to Toronto, and Mom says, oh, let's go see him. So they introduced me to him, and he said, I have lupus, da 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 da. And he asked me what I'm taking, and he goes, I shouldn't be standing up here. You should be standing up here, because your story is amazing. He says what you're going through and the supplements you're taking, people need to hear that, because they're only taking 1 alfalfa. It's not going to do a baby toe.
That's so true.
I think when you were in the hospital, correct me if I'm wrong, but they were very concerned because you were not urinating very much fluid.
Yeah.
And so then that's when we snuck in the performance.
Yeah.
And then the next day they said, wow, what's going on?
Yep, first.
And you know what? The bottom line is what you said earlier is that you have a choice which way you're going to go.
Mm-hmm.
And you said, no, I'm going to do this.
Mm-hmm.
And then they dismissed you, which is interesting.
Yeah, I was surprised at that.
But it's because they're taught symptom and drug.
Yeah.
They're not taught nutrition. So I used to get so upset until I understood that it's.
You know what helped too? When they give you your blood work,
Yeah.
always ask for your blood work. This is from, where is it? 1995. So it tells me what my potassium was, and anything in the bracket is where you're supposed to be. Anything out of the bracket is lower. So my potassium back then was supposed to be 145. Mine was only 40.
Oh, wow.
My chloride was supposed to be 108. It was only 2 point something.
Oh my gosh.
The creatine was supposed to be 115. Mine was only 20. So they were basing it on the numbers. So of course, that is when I was first diagnosed. So that's when they were looking at that. So that's why when I started taking the protein and the Liquid, that's when everything started jumping. And they couldn't believe it because from going from this low, it took about, I would say, 3-4 weeks to get it into my system. And then they started noticing the numbers going up.
It's so interesting that I don't think that we forget about Liquid, right? But that was is such a powerful product because it goes in so fast.
Mm-hmm.
And I know it's got higher levels of vitamin A in it. And if that's what helps really, I mean, if your immune system is not working at all, it's screaming for it.
I was anemic, and that's why.
Yes, and the iron in there. And I just learned recently from Dee Dee, believe it or not, that if you have an ailment, that the iron carries the nutrients to where it needs it.
Yeah.
I'm like, oh, we never quit learning, eh?
Amazing.
Any other questions?
No, but I've come up with an idea since listening to Sharon. And what I'd like to do, and I think, Nina, you can tell me if it work. I'd like to send this link to all my customers and say, would you take, 35 minutes and listen to the most incredible story of bad health to good health, especially relating to lupus. I mean,